Let's see. Hi, everybody. This is Dr. Magarelli from CNY Fertility. Happy Tuesday for our In Search of the Stork question and answer live. Hey, Brooke, good to see you. Monty, nice to see you. Kathy Dreams, nice to see you. Worth it at the end. It's always worth it at the end. I can't agree with you more. And hi, folks on the Facebook Live and YouTube. It looks like Instagram is taking off. Hello, Flutura and Proloquy Malachi, Kalinas. Hey, Smiley Shana, good to see you. Hey, Hallie, good afternoon. Jimmy Choos and the Oreo Speedwagon, that's great. Mrs. McCully, good to see you. Akasha, Kimmy. And then on the YouTube side, I guess we're still kind of slow starting here, but there they are. There's Jennifer, and then there's Jessica. Good afternoon, everybody. Hello, Wilhelmina Johnson, one wildflower soul. That's very nice, natural beauty. Hi, Sarah, good to see you. Or actually, see your sign in. Cindy, good to see you. Christina, Shiloh, and Jameis West, good to see you. Stella Licious, 79, gotta love that. MD Fassel, okay, that's a nice name. Cynthia Stevenson, good to see you. East Coast IBF joined. Let's hear it for East Coast IBF. Christina, nice to see you. Cindy, nice to see you too. Heather. So today, let me give you a couple of announcements. Hey, Deidre, I'll say hi to all of you guys. We're going to do question and answer, so you can ask any questions. I'll see if you can stump the professor here. Good news, we are just slamming it. Last month, we did about 135 cycles, which is a remarkably increase from the month before in terms of retrievals, transfers. We're hiring staff. Again, remember everybody, as of January, Colorado is a mandated state, so please talk to your insurance people, especially if you work in big companies. They are required to provide IVF coverage in Colorado. We, of course, you can ask for CNY. We are the premier program here in Colorado and the whole West. Oh my God, Jessica, congratulations. Your last transfer worked. Oh, that's fantastic. Okay, Heather, what should progesterone and estrogen be 5 days after embryo transfer in a completely natural cycle with no medication support? The numbers could be anywhere. Did you ovulate? Did you not ovulate? There's no number. Progesterone over 5 means you ovulated. Estrogen, don't worry about that. How long after a laparoscopy, I'm imagining, do you have to wait for a frozen embryo transfer? It's Aliva. It's about 4, at least 6 weeks, I would think, to get everything back to normal. In other words, not the first cycle, but the second cycle. Hey, Sam, hi, Schaefer. I had my egg retrieval Friday. My progesterone was 1.7, so I wasn't able to do a fresh transfer. Will I be able to do a frozen transfer next month? Absolutely. As long as you are back to normal. That's always the key, folks. The goal is to make one healthy baby. Progesterone, where should I be for transfer? Progesterone, where should you be for transfer? Progesterone. Well, just take the progesterone. There's no number. Doc T. Nerys, tested at day 12, beta was 5. Any thoughts? Yes, check it in 2 days. At CNY, if I'm able to come to the USA and I do an IVF with donor egg and add-on, will I know which eggs, embryos are mine versus donor? Oh my God, yes, we are never East Coast IVF. I had that today again. We do not mix eggs, like donor eggs with your eggs, and you guess. We do not mix donor sperm with your husband's sperm. We do not mix them. You know whose eggs, whose sperm, and that's for the child. Be positive, Jose Che Rivera. Be positive. How do I know I ovulate with my follicles not growing? I have a frozen embryo scheduled and my doctor doesn't seem to be worried. Also, adenomyosis transfers hurt. How can I prevent the contractions? Acupuncture can prevent the contractions. Valium, we give Valium with our medications. One level isn't good, Jessica. Thank you, Jessica. You should get me a second beta. Annie, would you recommend or be okay with natural transfer if the only issue is maternal age, but we are now using donor eggs? Annie, if you guys don't know anything about me, I am not a natural anything. Nature doesn't want people over 24 pregnant, to be honest with you. So using medications that have perfected the science of implantation, I recommend. Now, of course, we will do a natural cycle, which I don't know what that is because usually it takes some medicine. Let's see. If out of state, how many times do we visit the office and for how long? We are coming from California to Denver. Well, Catherine, what I would say is if you're doing a fresh transfer, you'll be here for about 5 days. If you're doing a frozen transfer, then you'll just be here 2 days and then the next month, 2 days. Yay, man. You're so welcome. Let's see. My last transfer was canceled because my progesterone was 3.67. Wondering what level it should be for a frozen. No, on Cindy, it must have been a fresh transfer that was canceled. Frozen transfers, we absolutely give progesterone. So don't worry about that. What do you recommend for repeated implantation failure? A workup for antithyroid antibodies, a workup for antiphospholipid antibodies, a workup for thyroid dysfunction, a workup for prolactin levels, a workup for your uterus to ensure that your uterus is safe, maybe an STD workup, don't smoke for sure. Those are some of the things I can think off the top of my head. Jeannie Marie, waiting on ERA results, had a laparoscopy and nothing was detected. Good. We have one genetically normal embryo from my own egg and his sperm. Great. Day 3 and 8 from donor cycle. How should we transfer? 3 day 3s. Got it. Well, if they're untested, I didn't see how old you were, but if you want to put 2. Oh my God, Evanson. You're pregnant. God bless you. God bless you. Inflammation is tough. So what the gal is asking is saying that because of her inflammation history, we really recommend things like the low-carb diet. Keto's kilts is another approach. We recommend our immune protocols, and please download our free family building guide. Go to our website, cnyfertility.com. Go to the resource page. We have an incomprehensible amount of information to help you understand acupuncture. Certainly, traditional Chinese medicine doctors trained with the American Board of Oriental Reproductive Medicine, the acupuncturists at the Healing Arts Center in Albany and Syracuse, great places. Can you still conceive after having a hydrosalpinx? You don't want to conceive until it's either clipped or removed, because that fluid inside the hydrosalpinx will, quotes, poison the area for the embryo. Not a good idea. What are the CMV requirements when using donor sperm? You want to match. If you're CMV positive, then you can use CMV negative sperm or CMV positive sperm. I'm a genius. Okay. The other thing is that if you're CMV negative, you want to use CMV negative sperm because, again, it's a virus that can be passed. There's my dear Jessica. She's amazing. Oh, Jennifer, it was drained. Okay, if it's not present during the transfer, you're fine. So make sure they do an extra ultrasound. Kelly, 43 and want to transfer my 1 tested embryo plus 1 frozen donor egg embryo if it makes it to day 5. Yeah, do not do that, Rihanna. Don't combine 2 sources of embryos. It's just, it seems like a good idea, but it really isn't. You want to, like, let's say the donor one works and yours doesn't, and you get a miscarriage because of yours and you take the donor with you. There's no benefit to putting in more than 1 in that circumstance. Do you all do a frozen transfer from another doctor? Yes. If so, what is proving? I have 5. I don't know what that is. I have 5 frozen embryos with another doctor. Well, as long as they've been appropriately tested, then yes. What is CMV? CMV is cytomegalovirus. Cytomegalovirus is a virus that 50% of children get, 50% don't. So we just like it to match. Is there a healthy BMI recommendation for IVF? Well, the question of BMI, body mass index, is what's the impact of having a large BMI versus an average BMI or a higher BMI? Well, the advantage is that there's fewer miscarriages, better implantation, but there's no reason if you can't change your BMI that you can't have a transfer. And that's one of the critical things that separates CNY from just about everybody. We're not going to pull you away or say you can't start just because your BMI is this or that. We just don't do that because the data aren't that strong. And so for sure, do your best to eat in a way that reduces inflammation. Kilt says keto, anti-inflammatory diets, acupuncture, avoiding alcohol, tobacco, drugs. That's what you should do. I transferred at 6 millimeter, got pregnant, but miscarried at 9 weeks. Can lining cause fetus not to develop? No, Morgan. Lining cannot cause a fetus not to develop. How does priming with estrates and progesterone help? It improves blood flow, Calmo, and it also can slough the lining a few times. Sometimes you need that. Let's see, Monica, 47, 2 failed donor FET. Should I use my own eggs? Well, Monica, if you use your own eggs at 47, you have less than a 1% chance that you'll achieve a pregnancy based on statistics. But as I tell everyone, you can't get 1% pregnant. You can only get 0%, meaning not pregnant, or 100%. That's it. So if you want to try, the other thing CNY is famous for, or infamous for, is that we are willing to help anyone use their own eggs. If it makes sense, meaning if you respond. Started acupuncture last week and I'm loving it. Smiley Shano. That's important, folks. A lot of people get a little bit scared about the little needles that they use for acupuncture, but that's small compared to the needle you're going to use to inject the medication inside you. So don't try it. I would just say try it. Let's see. Is it normal to get a period during priming? Sure, you can. Absolutely. You don't have to, though. Chloe, for an IUI, can there be any success rate with having low AMH? Well, Chloe, it's more related, yes, to AMH, but also to your age. So throw me back a question about your age. Brandy, we just experienced a biochemical, seeing some light at the end of the tunnel. Great. Nurse P said chances increased by 15% after biochemical for the next 4 months. Hope that is true. Not sure what she means. Every cycle is independent of the next cycle, but Brandy, the good thing, Brandy Champagne, I remember you. The next thing is that the keen thing is that you did get pregnant, which is a hopeful sign. 30. Yeah, so IUIs with low AMH at age 30, about a 1 or 2% chance of success each month. Rihanna, sorry I may have missed your response to repeated implantation with known endometriosis adenomas. What is a good protocol to try? Here a little bit of Orlistat and letrozole. Well, if you have endometriosis documented, then yes, suppression with Orlistat and letrozole is not a bad idea, or even Lupron, because it down-regulates it reduces the formation of the endometriosis, which can have a negative effect on your implantation as well as getting pregnant naturally. How does Gonalef work for an FET? It does not. You do not use Gonalef for an FET unless you're trying to ovulate. That's the only reason you use it. Jessica Veronica Corbin, why do you need to schedule a practice PISA before the actual PISA egg retrieval procedure? I've never heard of that, Jessica. Sorry, I don't know that. Sylvana, can ACG help male factor? Yes, especially with low testosterone. Will having hypothyroidism affect donor embryo IVF success? Absolutely, if you're going to carry, Melanie. Thoughts of taking Clomid after a miscarriage before we go back to IVF? I don't have any thoughts about that. That's not a protocol, or even I don't even understand why one might want to do that. Is it okay to do a donor embryo transfer without doing prednisone shots? Yes. Talk to your nurse or talk to the doctor for substitution. How soon can you start the process if you had a DNC 2 weeks ago? Give it about 4 more weeks. Corley said I have to use Gonalef and Neupogen for my frozen embryo transfer. Gonalef and Neupogen. He must be trying to grow your lining. That would be my only thought. Jana, my prolactin was 35, just retested today. Should I have any worries? Well, if that's above the normal range, then yes. You want to make sure that it's in the normal range. You should be retested fasting, no breast stimulation, no orgasm, early in the morning before eating. And if it's still high, then you may want to get an MRI of the pituitary. Corley said, okay, I've had 2 failed transfers. Have you done Amanda, have you done an ERA, an endometrial receptivity assay? Have you done acupuncture? Have you had a hysteroscopy within the last 6 months? Do anyone in your home smoke, Amanda? Or do you do the serovital growth hormone? Have you done HCG washes, PRP washes? Lots of things you can do. Hello, can I prepare my body for, hello, how can I prepare my body for the IVF process is, well, it's pretty general, but Healthy Body, Fertile Body. Go to our website, download our family building guide, and it'll tell you everything you need to know. When should I stop taking and ending meds before initial cycles start? Not sure which meds, sorry. Why do fair embryos implant well? Is it possible for a person who is a great performer implant all embryos, even one that makes a blighted ovum? Why do women make placental sacs without? Too many questions. Ask me one question. When should I stop taking norethindrol for endometriosis before the cycle? Just before the cycle, just before you start your baseline. I have this is Shakita. Oh, you did, Amanda, you did a hysterosalpingogram, hysteroscope, and a DNC. Good. So you got the rest of my suggestions. How much were your meds? I planned, okay, I don't know that. So, okay. Shakita, Google re-embryo blog for stats on day 7 embryos. Okay, I have a day 7 embryos. Genetically normal. What do you think the chances are successful FET? History of recurrent pregnancy loss, but recurrent pregnancy loss didn't show anything. I hope you did an ERA. How long do you recommend to take Orlissa? At least for 3 months. Alexander, I have my first consult on the 27th, and my OBGYN gave me Balcotra to control my ovarian pain and endo until I see it. Is that okay? Don't know what Balcotra is. I apologize. Kelly, should I wait to get to cholesterol for intralipids or have my monitoring clinic deliver before a frozen embryo? Well, Kelly, I think there's a protocol. Talk to the nurses. Of course, you can have them here, but I think if you do them more than once, it's probably a good idea. Why would a body create a great living space for a poor embryo to grow? There is one. You're asking a godlike question. In other words, why do things happen? Not sure. What is the benefit of HCG boosters? Okay, well, the idea there is to pre-prime, hello, Latoya, is to pre-prime the uterus. And there have been studies which say that by pre-priming with HCG, it increases implantation. You had endometriosis, Sheehan, and removed 2 years ago. Well, you might want to get rechecked. You want to make sure your thyroid is okay. Those are things you can do. Haven't done ERA, thank you for the suggestion, of course. Balcotra is a birth control pill that should not hurt you at all. When downregulating with Orlissa and letrozole, do you take prenatal, Orlissa, letrozole? Is there any other meds that should be taken during this time? It's not a matter of should, it's a matter of timing. Prenatals always stay on prenatals, for sure. I'm managing my hypothyroidism with Armour Thyroid and planning on carrying it with donor embryo IVF. It's pretty well managed. Will that help with this? Yes, absolutely, Melanie. Did an egg retrieval with Dr. Fink a few weeks ago, got 7 follicles, 2 embryos, 37 PCOS AMH. Go left, that. Did acupuncture as well. Anything I can do differently for my next egg retrieval? Yes. Did you say how old you were? 37. Okay. You did 375 and 30. Did you do growth hormone, serovital? Those are 2 things I would add. Growth hormone, serovital, 7 follicles, 2 embryos, okay. You may be able to increase your medications to 450 and 40. That might be an option. Can a pescatarian diet reduce inflammation? I'm on it as an endometriosis diet. Well, yes, endometriosis diet is an anti-inflammatory diet, so my suspicion is it may help. Does HCG only boost male testosterone, or does it help other sperm factors? HCG is LH, luteinizing hormone, so yes, it does increase testosterone, but testosterone in turn is important for sperm production. Ishita, Hello, Doc. I'm 38. My AMH is 0.9. My coach, okay. Do you recommend me to take supplements? Yes. Should we continue serovital after a fresh embryo transfer? P.S. I have the fastest recovery time from my retrievals last week. Good, Sophia. Sophie, I'm glad to hear that. Yes, continue to take it. Yes. Does acupuncture help with IUIs? Absolutely. Acupuncture can help with just about, sorry about it. I got to get back online here. I didn't touch my screen here. Let's see if we're still there. Wait a second. Reconnecting. Sorry about that. Hope we're back. Somebody on Instagram, see if we're back. Somebody say hi. Um, Anybody there? Hello? Yep, I got a heart. Okay. Um, do you suggest to do 1 or 2 embryos at a time to increase chances with IVF? I always recommend 1 because when you add, certainly I put in 1 embryo and gotten 3 babies, put in 2 embryos, gotten 8 babies. So that's not something you really want to run into. Hello, everybody. Thank you. Amber, my dear daughter. How are you, my dear? Good to see you. All righty. So how long does it take for HCG to work for male factor? 3 months, Silvana. 3 months. Heather, I have a small intramural fibroid between 20 and 33 millimeters. Small. Recurrent implantation failure with PGS normals. Wondering if I should try Lupron to shrink them or just give them surgically removed. I would get them surgically removed because you can't really shrink them permanently. And I would try an ERA, endometrial receptivity assay, if you're not being successful. Right, Jimmy Choos. The Jesus, yes, good. There you are. It's buffering. There we go. What type of PRP is recommended during priming for retrieval? The high volume PRP is there's not one or the other. You can do high volume PRP. There's not really been a study. Are you the doctor I had a consult with this morning, Samantha T? Yeah, I'm super excited to get the process started. Well, good. I'm glad, Samantha. I actually love your last name, and I'm sure you get that from a lot of people, but I love your last name, Samantha T. What a great name. How long does it take for ACG to work? We said that already. Awesome as always. I love you, my dear daughter. Annie, I'm 44 in September. Congratulations. I'm going to be something in September. I'm not going to tell you. I would be 14. AMH was 15. Woo, started IVF, but stopped because of a solid mass. It was removed last Thursday along with my left ovarian tube. I'm so sorry. I have PCOS. Would I be a good candidate for IVF with only 1 ovarian tube? Absolutely. And the higher your AMH, the more eggs available. Happy childhood in style. Do I have to have DHEA checked before I start to take supplements? No. It's 75, it's 25 milligrams 3 times a day of DHEA. Oh, it's actually Cherokee Indian. That makes a lot of sense. Would high levels of DHEA cause poor or low eggs for retrieval? No. I had low progesterone on max dose. What can I do next for frozen embryos? Low progesterone on max dose. Emily. Make sure you're doing the vaginal progesterone because the levels don't matter when you do vaginal progesterone. Okay. Serovital. Yes. Thank you, Jessica. Destiny, what are the odds of IVF with fresh donor eggs, but using frozen embryos for transfer being successful with no male factor? If they're less than 32, fresh donor eggs, untested, probably 40% to 50%. Britain, 31, recently diagnosed with PCOS, no other health issues, LGBTQ, so donor sperm. Do you think genetic testing is necessary having vetted sperm? Again, testing the sperm, testing the egg has nothing to do, or the person giving the sperm or the egg. That's not the genetics that we're talking about. When you do PGTA, you're talking about an embryo, which is its own entity. Now, at 31, do I think you need PGTA? No. Hey, Lindsay, good to see you. Let's see. Also, how much is the IVF with the genetic testing we spoke of this morning? It's whatever go to the website, and it's approximately additional $3,000 to add genetics to our $4,000 IVF. But again, talk to financial, and also it's on a website. Smiley Shanna, can ERA be done anytime, or is it during the transfer month? No, it's absolutely not done during the transfer month. It's done the month before. And can it be done during a hysteroscopy or just before? Yes. What is the age cutoff for freezing eggs? There's not an age cutoff. There's an egg cutoff. If you produce eggs, we'll freeze them. I am also a Niki. What is a Nikki MJ? Not sure what that is. A Nikki M. Oh, got it. Okay. Do you recommend PGTA testing after age 35? In other words, what's the goal of doing a genetic test on an embryo that's created in a woman? It's to find that out of a group, it's to find that embryo that has the highest likelihood of implanting. So it gets you to implantation or pregnancy quicker. It doesn't change the embryo. It doesn't make the embryo more successful. It makes the doctor or the embryologist selection more specific and more accurate for that embryo that's going to help you achieve a pregnancy. So that's the power. Is ovarian PRP offered in Colorado? Absolutely. Whoa, my progesterone has been 55 for my transfers. Is that too high? No. Do you recommend, I already went through that. I called and was trying to get meds to get my cycles regular so I can come get testing done. And I have PCOS and they will not give me any meds because there are no notes in my file. Misty, Mira, there are no notes in your file. So just set up a consult, Misty. Cabrizi. If my embryos are all day 5, is there anything else that would make one stand out to choose for transfer? Now, let's start with the day 5. We do not transfer day 5, 6, or 7 embryos. We transfer blastocysts embryos, which are at day 5 or 6 or 7. So the days of the culture are to get it to a blastocyst. Think of the embryo on day 3, which is called a cleavage embryo. So really, do you want a cleavage embryo or a blastocyst? So when you get a transfer, it's, do you want to grow them for 3 days or do you want to grow them for 5, 6, or 7 until they become a blast? Why would you do the blast? Well, if your goal is to have a butterfly, which I call a blastocyst, which will light and implant the uterus, in the uterus, then you want to take the caterpillar, which I call the day 3 embryo, and let it grow to a butterfly because not all caterpillars become butterflies, but all butterflies fly. So you're using the culture system to improve your odds of picking those caterpillars that'll make a butterfly and putting the butterflies in which have the highest chance of success. So what the grading is doesn't matter. Whether it's a, blue butterfly, gray butterfly, yellow butterfly, purple butterfly, it doesn't matter. Don't get hung up on the grades. If it's your embryo, it's the most important embryo in the world, okay? Can HCG be done during a hysteroscopy? Yes. And a DNC, yes. But that has to be pre-planned, though, leave us, Mama 94. Carol 991, is Zymat a good device for better sperm selection? That, in my opinion, it's not ready to be, I don't believe the data strongly support that contention. I really don't. I've looked, but I don't. Okay, baby dust all around. I'm 41, last protocol was Gonolef 375, HGH got 2 embryos, new protocol Gonolef 225, Menopure 450. You are not, Urazin, you are not going to hyperstim at your age and with that previous response. Your goal is to get as many eggs as possible. So you're not going to hyperstim, it would be very unlikely. What other testing do you recommend for implantation failure and chemicals other than the ERA and Receptiva? Not many more. Well, the antiphospholipid antibody workup. Is ovulation, if ovulation is predictable, do you still induce it? Absolutely. Thank you. You're welcome. I spoke with Dr. Kilson. He said that he has seen many beautiful, healthy babies come from an abnormal tested embryo. What are your thoughts on that? I think there are a few embryos that are described as abnormal, which may be normal, but there are no embryos, abnormal embryos, truly abnormal embryos, that make normal babies. Here's the distinction. When we test, we only test the placenta cells. We don't test the baby part or the inner cell mass. So what Dr. Kiltz is saying, in the world where 5 million IVF cycles are done, there's been about 100 babies, probably 250 babies born from what were tested erroneously as abnormal. It's the fact that the test is not perfect that's the issue, not the fact that abnormal embryos will make a baby. There is a fine distinction there, but that's important. What is assisted hatching and how does it help? Well, Sherry, in the old days, not now, but in the old days, we used to think that the thickness of the zona pellucida, the egg shell that the embryo was encased in, could sometimes restrict the embryo from hatching or getting out to attach. Right now, we basically hatch everybody, so we reduce any energy that might be used to break out of the shell to save for the embryo to grow. So it's basically a technique to dissolve some of the eggshell, but now we basically take a chunk off and allow the embryo to easily do that. What is the update on Sarasota? I was told that they may actually be able to see patients as early as September, but they're going to be monitoring. It's not retrievals, not transfers, probably not even IUIs, but at least we'll get the process started. But stay tuned. 41 AMH is 0.03. What do you recommend? Well, most importantly, Classy Christian B KB5 is donor egg, of course, because when you have low ovarian reserve, donor egg is your best and most successful option. But if you want to try your own eggs, and here at CNY, we absolutely are willing to try if we can get you to respond, then yes, we will try with your own eggs with IVF, but I would use the mini IVF protocol. Vanessa, should I have a lap after 3 failed IVF? Yes. Is there any? Okay. Should you start the downrate? Okay. What supplements do you recommend after the transfer? Obviously, some say do not to take them while pregnant. Not true. Just look at our family building guide. They're all listed there. You may have to do, okay. Hi again. What is the protocol for someone who doesn't get periods anymore preparing for a frozen embryo transfer? We call it the pre-ART HRT, which is simply giving you estrogen and progesterone until you develop a lining, then withdraw the progesterone to make you bleed. So it's just priming your system because apparently it's not getting a good dose destiny of estrogen. So you prime it with estrogen until you get a nice lining, stabilize it with progesterone, which we do in all menstrual cycles, remove the progesterone, which causes you to slough the lining or have a period, then you're good to go. Can you get pregnant with a bicornuate uterus? Absolutely. Do you have any success stories at 44 years old, and how many egg retrievals did it take? I am 44 and I got 10 mature and 12 mature. What are my chances of getting a good embryo? Yvonne, yowza, really good. Because again, age is interesting, but numbers are better. So the more eggs, the more embryos. The more embryos, the more normal embryos. The more normal embryos, the higher the pregnancy rate. So you're in pretty darn good shape, my dear, at 44. If you got 10 mature and 12 mature eggs, holy moly, that's amazing. Michaela, how do we know who our CMY doctor is? All of them are. I did a retrieval and a fresh transfer with you at the Colorado location. Would like to talk to someone about transferring 2 embryos next cycle. All of our doctors can read our notes. All of our doctors have access to our notes, so all of our doctors and nurse practitioners can help. Shout out to the nurse practitioners, amazing group of professionals who really help us take care of patients. Shout out to our nurses, our MAs. Shout out to the front desk people. They work the hardest trying to accommodate everybody. Shout out to the laboratory people, the andrology people, the endocrine people. Shout out to the financial folks who are navigating this whole financial process. Shout out to our partners, EIVF, Fertility Pharmacy of America. Shout out to our acupuncturists, massage therapists, nutritionists. Shout out to the fertile yoga group. Shout out to everybody, because that's who's taking care of you. With the, okay. They are the best. They are extremely painful embryo transfer. Is this normal? This is Kadaf baby. Do you have an idea of why this happens? Well, it depends. If you have stenotic cervix, meaning a cervix that's really tight, that can do it. Lots of love and kisses to everybody. So that could do it. Some women are just very sensitive, so acupuncture can reduce the cramping. You can ask for Valium. That may help you reduce, the pain. Yeah, it's hard to say exactly what could be endometriosis. Lots of reasons. Please explain why both prednisone and intralipid is recommended, Michael. Please read our family building guide. There's a whole section there on anti-inflammatory diets or low inflammation diets. So they're all explained there, and they're recommended for all women, not just over 40. What is the posology for the estradiol patch during priming? Don't know what that means. Yvonne, Michelle, awesome. The people that automatically disqualify our chances are the only ones that hold us back. Way to go at being an individual and take your best chances regardless of the age discrimination in the fertility world. Not sure what you're talking about, Sylvana, but go girl. I can take prednisone. I can take prednisone and have a bad reaction. Can I get IVIG? I have a beta to something antibodies. Yes, we do IVIG, especially the Syracuse office. They're very good at that. Okay, great. It's to help with less than miscarriages. Got it. Okay. Yes, that's the purpose of it. Yes. Had 2 IVF cycles. Now both my embryos only make it to day 3 and a rest before day 5. Is there anything I can do? Danielle. Well, Danielle, I don't know. Is the person making the embryos, is it a male partner? Does he smoke, drink, bad habits? Because that certainly will make a big difference in whether or not an embryo makes it to day 3 or even to day 5. Do you smoke alcohol, drugs? Not a good idea. Are you doing acupuncture? It sounds like you only get 2 embryos, so I don't know how old you are, but you have low ovarian reserve. So those are kind of the things I think about. Does HCG wash help with implantation? Absolutely. Just read our family building guide. BBS Vida, 43, AMH 0.07, but all other levels are normal. Mini IVF, yes. Acupuncture, yes. Serovital, yes. Growth hormone, yes. Kielce's keto diet, yes. What is the protocol for HCG to treat male factor? It's done. Yeah, obviously, that's not something I have in my head. Is it necessary to take all the medications before the egg retrieval, Brandy or Bandy? You follow the protocol. The protocol is what you do, nothing else. So the protocol tells you what meds, how to take them, when to take them. And again, what is the best age to freeze eggs? Between the ages of 20 and 24. That's the optimal time to freeze eggs. The second question is, can you freeze eggs at any age? The answer is yes, as long as you understand that it takes about 20 eggs to make a baby, right? It takes about 20 eggs, which will give you around 10 embryos, which will give you around 3 chromosomally normal untested embryos, which will give you a baby. That's kind of the numbers. Does an endometrial scratch help IVF to succeed? Some people think so. I don't think the data supports it strongly. There is some controversy. We certainly do it if you like. Can I please PM you? No. No. But you certainly can set up an appointment through the portal and say you want to talk to me. Yeah, but I think PM means private message, no. We are about to celebrate my father, cancer-free. Can I have a beer during transfer meds? Just one, Cindy. Just one. Excellent. Congratulations. Tell your father, God bless. No, it was for Yvonne. Okay. Okay. I sometimes watch you guys have conversations and I'm just watching them. How about anybody on the, what is mini IVF? This is on Instagram. Mini IVF is just a low dosages of fertility medicines to save money. I've done a whole talk on mini. Just go look at our history on CNY fertility. Look at the historic Facebook Lives. I did a whole talk on mini. All right. IVF success rate with PCOS is based on your age. I just had an egg retrieval Wednesday, 24 retrieved, 14 mature, 10 fertilized, 4 blast. Woo, woo. Nice job, my dear. And even more are looking at it today. Fantastic. Yeah, you have a very good chance. I know they're not untested, but I think there's a baby in there. Remember, you have a 0 or 100%. Is there any way to do a transfer without a full bladder? It hurts. Well, not if you want to do it successfully. I mean, you can do a half full bladder, but you have to get the uterus straight so that we can get the embryo in, the catheter inside. And the more we struggle getting a catheter in, the lower the pregnancy rate. So you want to make that transfer as smooth as possible, and that's why we fill up the bladder so we can visualize the transfer of the embryo. 22, that's fantastic, young lady. Amaka, nice to see you. Brandy, I'm taking testosterone for my transitioning and I am getting ready for an egg retrieval. So do I necessarily have to be off my medication? According, Brandy, to what I've read, the answer is yes, but it's very short term. But yes, be off the medicines while you're trying to get your eggs. Is a 26 millimeter follicle too big for IUI? No. Is there any, I don't know. Okay. Misty for PCOS, read up on myo-inositol. Yes, myo-inositol is something very good for folks with insulin resistance. PCOS is an insulin resistant problem. Okay, Michael. Good. Okay. Is there anything special that needs to be done for a retroverted uterus for transfer? No. No, not at all. In terms of a transfer, you don't need as full a bladder when it's retroverted, not as full a bladder. Melissa, I had 45 follicles, 23 mature eggs retrieved in Colorado on May 15th. Fertilized, 3 made it to the blast stage. We are out for testing now. Seems like a disappointing number. Any thoughts or recommendations? Not at all. It sounds like you might have PCOS or high AMH. 50% of all eggs from a PCOS patient are likely not to be fertilizable. So of that 23, you expect about 15 to fertilize. 15, I don't know. In May, 15, nice guess. But, and then of those 15 that fertilized, you expect about 8 to get to day 3. And then of those 8, you expect 4. So you got 3. So no. I have a tilted uterus. Would this be an issue during transfer? Quinique, not really, as long as we know ahead of time. What's it called again? Oh, I don't know what that is. Myo-acetone? Myo-inositol. 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 What's a lap? That's short for laparoscopy. That's where it's. That's where we take a camera, put it through the belly button, look inside. It's a surgery. How successful can IVF be in a woman with PCOS and high AMH? Very. Caitlin, myo-inositol. myo-inositol. Arath, I have a bicornular uterus, septum removed, but have 2 distinct horns. Could we aim for one specific horn with IVF due to 2 classical incisions on one side with uterine thinning at C-section? Absolutely, we can try, but remember the embryo travels at least 2 days if you do a blastocyst transfer in the uterus, and it travels 4 days to 5 days when you do a day 3 transfer. IVIG is, I think it's intravenous immunoglobulin, Cindy. You can look that up. Let's see. Nicole, I've had 2 failed egg retrievals. Next step, we are getting a friend donating her leftover embryos. How many embryos can we transfer at once? 1. Any extra tips for transferring with donated embryos? Donated embryos, no, there's no difference. And 36 and no uterus, so no periods. So should I be worried about not having reserved eggs? Well, yes, start doing egg freezing now. Have you seen success with a 2-cell and 5-cell? Yes. What is the difference in success rates with injectable progesterone versus suppository versus oral or combo? Tara, the number one shown, proven best is progesterone in oil. Number one, everything else is second to it, but there's not that much difference. When using donor eggs at 41 old, should we move with fresh or frozen? Fresh. Is really heavy immune treatment for people with wacky antibodies. Thank you, Heather. Best description I've ever seen. I'm going to say that on my boards. Lee, Belong, Katie, can I transfer 2 PGT normal embryos if we're failed with 4 untested and 2 PGT normal? If that's a discussion with you and your doc, likely they may. But remember, one embryo can become 3, 2 can become 8. And that's not a good thing. Cara Regina, I've had 2 failed frozen embryo transfers. Do you recommend we try fresh? Cara, do 2 failed frozen embryos? That's well, yeah, you can do a fresh transfer. That may be advantageous to you. Yeah, that's not unreasonable. Yeah, I don't know what that is. Can transferring 2 embryos at once improve chances of success in terms of live birth, or the opposite? Yes and yes. It can improve live birth rates, but it markedly increases multiple pregnancy rates, which are the bane of our existence in IVF. It's the reason why IVF is not a covered benefit, is because in the beginning we made way too many twins, quadruplets, quintuplets. So please don't strong arm your docs. Putting more in doesn't really raise the pregnancy rates. It just raises the multiple pregnancy rates. There is a slight improvement, but it's not worth the risk. And also, we want to have the whole country be consider infertility a disease, so they can be covered without a lot of hoo-ha about that's not the right thing to do. All right, I think either you're wearing out or I'm wearing out. Any more questions? Why would you see more follicles in an ultrasound than retrieval? Great question. What are like a follicle? Do all follicles have eggs? No. Can you sometimes have 2 eggs in a follicle? Yes. So we expect about 70% of mature follicles, not counted follicles, mature. What's mature? 18 millimeters and greater, 16, 17s, 17, 18, 19, 20, yes. So if you count 20 follicles and there's only 5 that are above 18, you should get 3 eggs. Okay? Does that make sense? Okay. What would you recommend for PCOS with failed transfer and everything was fine? Well, Vanessa, the PCOS is not necessarily the problem. It's just simply with folks, Escobar, with folks, they think that IVF is a cure-all. Even in 20-year-olds in America, it takes 3 IVF cycles to create 1 baby. That's the statistic. Again, that's a statistic, but that's the one you should remember so that you don't think that every single transfer gets you a baby. It just doesn't. Luteal Lupron protocol, will it improve fertilization rate for someone? Not at all. When should my husband release his baby for a less awkward? Okay. Okay, so how long should a man abstain prior to providing us a sample of sperm? It's 3 days. So it's 3 to 5 days is the abstinence, okay, for the male, so it gives us a good sample. Proloquine Malacca. I had an X-ray hysterosalpingogram today. It was painful. Does this mean I have a blockage? Could this have opened my tubes? Yes. Yes, yes, and yes. Sometimes HSGs, are hysterosalpingograms, which is the X-ray of the uterus, hurt because of blockage, and the guy, you try to unblock it, and sometimes, yes, you can actually unblock. About 15% of oil-based HSGs, there's an increase in pregnancy rates, so that's pretty good. A lot of you guys are having a conversation with each other over here. Butterfly, words of wisdom, not what we want to hear, but it's what we need to hear. Yeah, I hope you all realize I'm going to answer your question, but I'm not going to give up hope. I will answer your question with the best science I know. And again, science is mutable, it changes. But you got to hear a straight talk about what your options are, and then you choose. That's the difference with CNY. A lot of places will do straight talk, and then they'll limit your choices. With CNY, we'll give you straight talk, or I will, but if you want to try something and you have a chance, then you bet. At what age should you use donor eggs? Well, donor eggs are when there's low ovarian reserve, which can start as early as 35, but really it's based on your AMH, or if you've not been able to get a response with medications, then you can use donor eggs. But there's no force, I'm sorry, I should say, in our practice, we do not force people to use donor eggs. I'm so excited for my retrieval in Colorado Springs. I'll be there for my second ultrasound on Thursday. Well, Sona Muchutin, make sure you say hi. Okay. All right. Does the ATL Atlantic location still have a trial procedure for men with infertility? No idea what that is. What are the reasons for low beta after day 12 after a frozen low beta? Well, you may not be pregnant, or the pregnancy is not growing, or you just wait 2 more days and it may go up. If my husband can't travel in short notice, will freezing and shipping the sperm? Perfect. But you want it there, Quinique, 2 weeks before your procedure. 2 weeks before your procedure. Does SSRI medication affect egg quality? Not that I know of. Is there better to start with IUI or IVF for a tilted cervix? Neither. It has more to do with your age and your fertility potential based on your egg, your sperm, your uterus, and your fallopian tubes. If we do a fresh transfer, do we have to wait for day 3 or for day 5? It depends. As I said before, if you're lucky enough that you can grow to day 5, please do it. And we're trying to make it easy for you folks. And we basically say if you have 4 or more embryos on cleavage day, which is day 3, grow it to the blastocyst stage, which is day 5, 6, or 7. 5 or 6 or 7. And let me do one thing to clarify to folks out there. We had a very frantic patient. You will not get a call on day 5 and day 6 and day 7. You will get a call from our team after all of the embryos have reached blastocyst stage or simply have not grown. We will not call on day 5 and day 6 and day 7. We will do day 5. When they're all done, we will call. If they're not all done, then we'll call on day 6. If they're all done, we'll call. If they're not, we won't. On day 7, that's usually as long as we grow them, then you'll get your information. Escobar, low AMH from 0.04, low progesterone, normal FSH and estradiol. Right block tube, took letrozole, pregnant but miscarried last July. Sorry about that, Escobar. That's the only question I see there. So if there's other questions, I don't know. Okay. When should you order your medications? Well, that's done by your team based on your baseline, when your baseline is. It's going to be before then. But let's see. Husband, Alyssa Marie Bankers. Husband and I are not infertile. We are carriers of 3 gene mutations for cystic fibrosis. I've had 2 separate frozen transfers that resulted in miscarriages. What's the correlation? Well, I'm not sure. I'm assuming these are PGTM tested embryos and PGTA tested embryos. And so just because it doesn't have a gene doesn't mean that the chromosomes are normal. Just because the chromosomes are normal doesn't mean all the genes are normal that aren't tested. So it could be that the endometrial receptivity wasn't correct. So there you go. So there you go. Super random question. How is a transfer done if someone doesn't have a cervix? Transmyometrial. You place a needle just like the IVF needle, and instead of putting an embryo through the cervix, you transfer it directly into the uterine cavity where the endometrium is. After consultation with CNY, what's the turnaround for starting medication? I had a consult in October of last year. It should be 30 days, maybe 60 days. So get on the phone, get on the phone, get on the phone. Say, yeah, no. It's when you get a consultation, it's 2 weeks you should hear from the financial group if you don't call. After that, you call either the travel group or the local clinic, and you tell them you're ready to proceed. What's the oldest patient you have worked with that used their own eggs to have a baby? 43. That was successful. After consultation with COI, what's the turnaround? Oh, I did that. Okay. This year. No, it couldn't be, Aubrey, that you had a consultation in October this year, because October is not here yet. Okay. If you have a successful implantation, doesn't that automatically mean that you are receptive even if it ends in miscarriage? Yes. Yes. Michael, help them help us. Not sure what that means. Okay, we got about 2 or 3 minutes here, so let's see what else we got. I haven't decided what my topic is next week. If you want to throw some ideas out there. Okay. Javon, this is a follow-up question I asked about Atlanta. I was told by a nurse when I called 2 months ago that there was I don't know what it means. So just call Atlanta. Do you recommend intralipid day of transfer? Yes, Lindsay. Cindy, HCG watch causes false pregnancy test. Yes. How long should I wait to test? Well, 14 days. What is the best day to freeze embryos? 3 or 5? Blastocyst is the best blastocyst. I have a consultation scheduled for this October as well. Good. I'm 35 and had 2 egg retrievals with 9 and 17 eggs, no PGS, normal embryos. Is that any point in doing another? Well, no, just transfer them. Just transfer day 3s or day 5 and let your body decide which ones are chromosomally normal. Can elevated natural killer cells cause the transfer to fail? According to some, yes. According to some. How can we prepare our uterus for implantation? Acupuncture, avoid alcohol, tobacco, drugs, the keto diet, ERA, endometrial receptivity assay. I am looking to do a retrieval and fresh in October, November. Do you do the ERA there at Colorado location, and can it be done between retrieval and fresh transfer? Yes. How many egg retrievals do you assess if I do 44? I'm getting 10 mature eggs per retrieval to get, wow, that's fantastic. So at least 20 eggs frozen, or embryos frozen. Crystal, do I recommend across the board PGTA? Nope, I don't. There are certain circumstances, but nope, I don't. Do you recommend Zybot for male morphology issues? I do not. I am 41 and have recurring and fast-growing fibers, and we have determined that a surrogate is our best chance of a healthy pregnancy. Are the success rates the same with a surrogate as it would be with a healthy mom? Actually, they're sometimes slightly higher, as weird as that sounds. Can I start payments before consultation? I don't think so. You just do that in your own account and you collect the interest. Well, okay, folks, I think I'm going to wind down. This was absolutely wonderful and challenging. Colorado is full steam ahead. We got lots of, just to remind everybody, in January, Colorado is a mandated state. Please demand from your insurance company starting January that they cover your IVF. Your big companies, make sure they do cover IVF, especially if they're not self-funded. Do talk about CNY fertility to your HR people, because remember, even with mandate, you still have co-pays, etc. And if our fees are much, much lower, then you may get a lot more cycles for your coverage. So that's something. You're so welcome, everybody. So that's very good for us all. We're still desperate for getting more nurses. So if there are nurses out there who want to work in beautiful Colorado Springs, please, please, please connect with us. If there are reproductive endocrinologists that you love but want to move to Colorado, we definitely need more docs. We're expanding very successfully and very happily, but we really want some good people, and you guys probably know lots of reproductive endocrinologists. Can we have your cell phone number? I'm assuming you're talking to somebody else, Lindsay. So anyway, that's just some brief announcement. Blessings to you all. You guys, remember, nature wants you pregnant. You're not fighting nature. A healthy body is a fertile body for men and women, so avoid alcohol, tobacco, drugs, vaping, marijuana, none of it is conducive for fertility. No, you can't have my cell phone number. You can certainly call the 800 number. Anyway, thank you, everybody. Have a wonderful evening. Thanks for sharing your day. I always actually look forward to these, believe it or not. It's one of my favorite things to do. So you guys take care. I will